Dental implants have become the new gold standard for tooth replacement because they restore the function the best, and it's mimicking as if you have your natural tooth there because the implant is screwed into position and it's acting as if it was your natural tooth. With other replacement options like partials, dentures, they're removable, so they can come in and out, and they're not in line with the rest of your teeth the way that they are with implants. Implants are, implanted into the jawbone, and they act as if it was your natural tooth structure. So that's why they've become the new standard, the new gold standard. It's the best option for patients, and it's the number one option. And that's what we always try to, advocate for and get our patients to go for the best option. Otherwise, you're setting unrealistic expectations with other types of prosthesis, and then that can lead to disappointment and, not liking a certain type of prosthesis, whether it's a partial or whether it's a denture. So I've noticed that patients feel at ease the most with dental implants, and they adapt very well when it comes to dental implants because, like I said, it's as if you have your natural tooth there. So there's really no difference in the function. It's just the best replacement option. With dental implants in patients who are missing teeth due to bone loss or periodontal disease or trauma, however the tooth went missing, we try to educate our patients to let them know that this is not only restoring the aesthetics and the appearance of the tooth itself, it's also restoring the function. Because when we lose one missing tooth, it creates a domino effect for the rest of the teeth. And, other teeth can go missing in the arch because of that. So one tooth can lead to a lot of teeth being lost down the line. This domino effect can happen over time. Teeth, I always like to tell people, teeth like to touch each other. So if you have one missing tooth, the tooth behind it will start to drift, the tooth in front of it will start to drift, then you may lose that tooth down the line, or the tooth in front of it down the line, and then you may be more susceptible to having periodontal disease in the future, and that can create a number of issues. So I always like to advocate for the best option, which is the dental implants, and tell people to restore the function while they can, and while that area is preserved, because sometimes you get to a point where you're not eligible for dental implants anymore if you wait too long. That's a really big factor too, because if you don't get a dental implant within a certain number of years, you may go a long time and then you're not eligible anymore. That's when those options become limited. So I always try to advocate, close to when the time the missing tooth happens, or if there's enough bone in that time frame and we're able to place it at that time, I'll always advocate for it because it's the best option right there and then, and it will prevent a number of issues from happening down the line. One missing tooth in an arch can lead a patient to not feel confident overall. When you have a missing tooth, especially in the front area where it's in the aesthetic region or the aesthetic zone, people tend to hide their smiles, or they tend to cover their smiles and not feel their best or not feel comfortable. With dental implants, it's probably the most conservative options when it comes to replacing a missing tooth, especially when it's just one missing tooth, because we don't have to shave any of the adjacent teeth or prep any of the adjacent teeth. We're able to restore that one missing tooth with just one single implant, or whether it's one or whether it's multiple. But usually, majority of the time, when patients come in with one missing tooth, they can opt for that option and just get that one implant done, and as if they have their natural tooth back, and as if nothing went missing in the first place. So it's definitely the best and the most conservative option, and that's what we try to get our patients to do at the end of the day, what's best for them. And we see the most optimal results with dental implants, and patients are the most happy with the dental implants, replacing one missing tooth or replacing multiple.